practicing dentist from Stockton, California, and I discovered Brian Allman's reputation from a study club. I'm involved with the Seattle Study Club group in Stockton, and I was impressed by what the guy had to say. And I came up here. I first started with his online sleep academy with a webinar, and that was phenomenal. I did that first, and it was kind of getting your feet wet. And the reason that I've been pursuing the course, it's not out of having a bucket list per se, but I think the reason that I'm here is because you can learn very fast from his mistakes. When you look at what he's got, and when you look at how he was practicing over time, you can see why he's evolved to where he is, and it's a fast way to get experience. So I've always been a believer of talking to proficient people and gaining by their experiences, and as I get older I realize I should have listened a lot more when I was younger. So sign up for the classes.
How do you feel that the courses have added value to the new patients coming into your office? Or
you will diagnose forever differently. Okay. I think the referrals as far as sleep, if you think it's going to be just an obese male, female in mid to late 40s, I think you're in for an awakening. Last week, a 6-year-old went over, had the sleep test, and tested it for apnea. And it was through the diagnostic skills I obtained through Brian that made it possible. So I think the big thing most of you have to realize, and what you will realize from the webinars or from your readings, is that almost 40% of the people that you'll be referring for tests for sleep studies won't be obese people. So also the support staff's been wonderful. You feel like like a part of their family, and it's a great environment to learn.
Tell us a little bit about the hands-on course, the 201A.
The most valuable thing that you learn in 201A is repetition. You're put into a learning environment, and just when you think you know something, you'll be doing it probably another 5 to 7 times. For many of us who've done sleep appliances, you've probably used 1 or 2 or 3, and they've been maybe Great Lakes or your local lab making something. But I think the value here is we leave with 8 appliances, and you see the similarities in them, but you also see the advantages of using one over the other, and that's a real advantage. So you can you'll be proficient in temporary appliances, but that's never a substitute for a permanent appliance. But the thing is, they're an essential part of your armamentaria in treating sleep patients.
What would you tell a dentist who's considering whether or not to get involved with dental sleep medicine?
Why aren't you here? That's really, I'm amazed, because I think it's going to be a growing, the population's there. I'm 60 now, and I think you look at the people out there, and the recognition is, I would say, formerly 2 years ago, how many times was I talking about apnea with patients? Maybe a dissatisfied or a wife that was complaining about her husband snoring. That was pretty much the factor. Now you're diagnosing fatigue. It becomes part of your exam with your patients. Do you have acid reflux? How's your sleep habits? Do you get up a lot at night? And quickly explain to them why their behavior matches that of an apneic. So I think the recognition's good, the education's good. Brian's full of buzzwords, things that really help you, or they're helpfully that really help demonstrate to the patient what their problem is. And as most of us know, the educated patient will purchase more of your services. But that also holds for the dentist as well. They'll purchase more classes, and I've certainly been a student of that.